Graft-versus-Host disease, that is GVHD. Graft-versus-Host disease, most commonly seen in the setting of hematopoietic stem cell transplantation. Graft-versus-host disease is most commonly seen in the setting of hematopoietic stem cell transplantation. Pathogenesis: when immune compromised recipient receive hematopoietic stem cell transplantation preparation from allogenic donors. The immunocompetent T cells present in the donor. The immunocompetent T cells present in the immunocompetent T cells present in the donor inoculum recognize the recipient's HLA antigen as foreign and react against them, mediating the injury. So graft versus host disease is most commonly seen in the setting of hematopoietic stem cell transplantation. पैथोजेनेसिस: जो रेसिपिएंट है वो इम्यूनो कॉम्प्रोमाइज्ड है, वो हिमाटोपोइटिक स्टेम सेल ट्रांसप्लांटेशन रिसीव करता है, ठीक है, फ्रॉम अ एलोजेनिक डोनर. तो जो इम्यूनो कॉम्पिटेंट टी सेल प्रेजेंट है डोनर में, डोनर इनोक्यूलम में जो इम्यूनो कॉम्पिटेंट टी सेल है दैट विल रिकॉग्नाइज द रेसिपिएंट्स HLA एंटीजन एज फॉरेन एंड रिएक्ट अगेंस्ट देम, मीडिएटिंग द इंजरी. ठीक है, तो डोनर के इनोक्यूलम में जो इम्यूनो कॉम्पिटेंट टी सेल्स है दे विल रिकॉग्नाइज द recipient's HLA antigen as foreign antigen and react against them, mediating the injury. Manifestation: acute graft versus host disease and chronic graft versus host disease. Acute graft versus host disease occurs within days to weeks after the allogenic hematopoietic stem cell transplantation. It occurs within days to week after allogenic hematopoietic stem cell transplantation. Clinical presentation: generalized rash, jaundice, and bloody diarrhea. Clinical presentation of acute graft versus host disease: bloody diarrhea, generalized rash, and jaundice. Acute graft versus host disease, it occurs within days to weeks after the allogenic hematopoietic stem cell transplantation. Clinical presentations: generalized rash, jaundice, and bloody diarrhea. Generalized rash, jaundice, and bloody diarrhea. Chronic graft versus host disease, it may follow the acute syndrome or may occur insidiously. Chronic graft versus host disease, it may follow the acute syndrome or may occur insidiously. क्या ये acute syndrome के बाद हो सकता है या slowly हो सकता है. क्लिनिकल प्रेजेंटेशन: फाइब्रोसिस ऑफ द स्किन, कॉलीस्टेटिक जॉन्डिस, उसमें भी जॉन्डिस था, यहाँ पे कॉलीस्टेटिक जॉन्डिस है, ईसोफेजियल स्ट्रिक्चर्स एंड रिकरेंट एंड लाइफ थ्रेटनिंग इन्फेक्शंस. chronic graft versus host disease may follow the acute syndrome or occur insidiously. Clinical presentation: fibrosis of the skin, cholestatic jaundice, esophageal strictures, and recurrent and life-threatening infection. Clinical presentation: fibrosis of the skin, cholestatic jaundice, esophageal strictures, and life-threatening infections. The graft versus host disease or GVHD, it most commonly occurs in the setting of hematopoietic stem cell transplantation. Pathogenesis: when the immunocompromised recipient receives hematopoietic stem cell preparations from the allogenic donor. The immunocompetent T cells present in the donor inoculum recognize the recipient's HLA antigen as foreign and react with them, mediating the injury. Manifestation: acute GVHD occurs within days to weeks after allogenic HSC transplantation. Clinical presentation: bloody diarrhea, jaundice, and generalized rash, jaundice, and bloody diarrhea are the manifestations of acute GVHD. Chronic GVHD may follow the acute syndrome or may occur insidiously. Clinical presentation: fibrosis of the skin, cholestatic jaundice, esophageal strictures, लाइफ थ्रेटनिंग इन्फेक्शंस, क्रॉनिक GVHD के मैनिफेस्टेशंस होते हैं फाइब्रोसिस ऑफ द स्किन, esophageal strictures, polystatic jaundice, fibrosis of the skin, esophageal strictures, and recurrent and life-threatening infections.